454 positive tests in Tulsa County. That's out of about 6,000 tests taken. We have 26 deaths as of this morning, and we're seeing the vast majority of those who have passed away have been in that 50 and older age group. We are hopefully getting much closer to ramping up testing. That's one of the things that's been holding us back is not so much the supplies around test kits, the collection kits, the swabs, and the viral transport media we use to transport samples to laboratories. That's the supplies that we really had difficulty finding. But hopefully that we're getting a handle on that supply route as well. So, we've been tracking right now. We're in Tulsa County. We've been modeling the data. We are expecting us to peak really after tomorrow, and we're seeing a plateau of cases right now, which is a positive thing. That means all the shelter in place and the staying apart we think is working. I know the governor announced yesterday that he was opening things up, and I know economically it's been really difficult, and people are really want to go back to work, and I understand that completely. I would feel the same way, and I just think that as we talk about opening up, we need to be careful, and it needs to be a gradual, incremental opening, and really not, like I compare it to a faucet. We need to have that faucet drip, 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 as opposed to turning that handle, letting it gush. And so I know the governor put out quite a bit of guidance around opening. We're actually writing guidance for businesses in Tulsa County as well, trying to be more business specific, starting with those self-help or personal care businesses the governor mentioned, hair salons, cosmetology, those kind of things, and moving on to restaurants and bars. And then, because really, as we open up, we want to make sure that our facilities, both employees and staff, are safe, and then their customers are safe as well. So, I think for here, the data, as I say, we're not declining. I know that the president's guideline was decline for 14 days. Frankly, as we ramp up testing, I'm not sure we're going to see a decline because we're testing more. I think it's a positive thing to see a plateau of cases as opposed to the decline because we are increasing testing. So, and I think we'll have a much better handle early next week on really what the data is telling us about. Is this going to ramp up, or are we going to get even more positive cases, or are we going to continue to plateau? Another thing we have been looking at is mobility data. Google has an app, so anybody with a cell phone, we can actually get mobility data, and we have seen that the past 2 weekends, not the weekend before, but this past weekend, people were more mobile, and were coming together more. So we know that that's starting to happen as people stress and anxiety and patience were in with sheltering. So we'll continue to follow that mobility data, and if that coincides with an uptick in cases, we'll know why. So that's kind of the Reader's Digest version of where we're at, and kind of where we expect to go. Oh, one more thing we do. So, we have been doing in the past. We've always done surveillance of emergency rooms during flu season to let us know just the penetration of flu-like illness in our community. We've now added COVID-19 symptom set surveillance as well. So we'll continue to get information from emergency rooms that tell us what they're seeing in terms of symptoms, and if those symptoms are specific or relative to COVID-19.
Great. Well, Dr. Dart, do you have time to answer a few questions?
Yes, I do.
Good. I know I've got a few. I'm going to open this up to the council first, see if anybody has any questions for you.
Dr. Dart, of the 454 cases, do we know how many have recovered?
Hang on. That's actually on our website, and I think it's over 300. But let me look it up real quick.
Okay. Thank you.
What's the criteria for recovery?
So, originally, of course, they wanted negative tests, but frankly, we didn't have the test material to test those recovery cases. So we've been saying 14 days symptom free, and then at least 3 straight days of fever free, and not using any fever reducing medication. So I'm on our website, and out of our 454 confirmed cases, we have 330 that have recovered, 98 are still active.
Thank you.
Dr. Dart, I don't know if you've seen the USC and Stanford study, or if you've heard about that out in LA and out in Palo Alto.
No, I haven't.
So Stanford did one of their, I guess their research department out there did a study in Santa Clara, and as you know, LA is one of the most locked down counties in the country. I mean, absolutely locked down. And so USC, which Palo Alto is fairly close to LA, but they did they had people come in and they found that almost 81,000, and of course, obviously, this is from a sampling, and they extrapolate that out and they come up with the numbers. But they're saying that nearly 81,000 residents of Santa Clara had actually been infected by the disease whenever they started doing testing. And these weren't necessarily people that had to go to the hospital or anything. And then USC actually backed that up, and that between 2.8 and 4.6, and it's basically 4% of Santa Clara, 2.8 to 4.6 of the adult population in Los Angeles County has an antibody to the virus, which equates to about anywhere from 221,000 to 444,000 people that actually had it. That is basically 28 to 55 times higher than what they had predicted, as far as have it. And so my question to you, since they have, and of course these are two independent studies, but we're finding out that it's going to be closer, instead of the 3 to 4% that they thought would actually, the death rate is that knocks it down to 0.12% or 0.2. But the biggest question I have is that even though it was locked down tighter than a drum, the number of cases or people that had contracted were basically, there was really not that much difference in people that weren't locked down, and then the number of deaths from it were basically were less or the same as those places that weren't locked down. So how do we square that information?
So so one thing about this virus is that it's extremely efficient at transmitting. Now you look at places like California and their population density. Their population density is much more compacted than here, and that's why, for example, with the president's guidance about 2 weeks of decline, I think with our population density, if we saw 7 days of decline, I'd feel really good that positive things are happening. And I also think that if we were to do antibody testing across the board here, we'd probably find similar results. I mean, I think it's been in our community longer than we know of. We know that so many people are either experience very mild symptoms or no symptoms. And of course, those people aren't being tested. But I'm willing to bet that if we did antibody testing across the board, we'd probably see a similar result. But it does help here that we're not packed in so tight, and we have greater space in our communities than they do in California, especially in that LA and that Southern California area. So, and just the population densities, even though they're locked down, it's going to result in transmission that we probably wouldn't have that to that degree here, just based on the nature of the structure of our communities.
So basically, whether they're locked down or not locked down, the transmission seems to be that it's going to be very close to the same.
So, and I'll be honest, I don't think it's so much the lockdown, it's the mobility. Because even in lockdown, people are free to move around in some capacity. And it's that mobility that is really the construct, the conduit for chain of transmission. And anytime you have people, whether it's just even going to parks and trails and those kind of things, they're asked to stay 6 feet apart. I mean, I've been on the trails the past 2 weeks, and that's not happening. So even though we still have the lockdown, people are coming together, and we're still going to see transmission.
And then the last thing, so basically much is the same as the CDC was. Obviously we use numbers based on what the CDC said. Here's what's going to happen. Here's what we think. And so we kind of based our numbers on the same, but neither us, being the Tulsa County, or maybe even the state or the CDC, we're not anywhere even in the same stratosphere as what we thought the numbers were going to be, correct?
And that is correct, and like I said, we always do, our models are strictly based on assumptions and projections that we make. Now, one of the things that we haven't been able to do because of our shelter in place, we originally started out, and I think we talked about this before, but we have a figure we call R naught, and that's R0. And R naught is that figure, that's the number that one person can infect. And so originally our R naught figure was 2.5, so one person could infect 2.5 people. And then after our shelter in place, we actually were able to get that R naught figure down to 1, which is really a positive thing, which means that we're affecting less people because of that.
Dr.
Thank you
Dart,
very much.
we've got data here in Owasso. We've been tracking our positive cases, and since April 10th, we've had a 10-day decline. We went from 12.7, 3 6s, couple threes, couple twos, couple ones. Explain to us and to our citizens that are listening how that applies on a smaller scale, like a city of Owasso. Is that downward trend significant at this point? How do you read that? Is there enough numbers here to even justify that trend at this point?
I think any set of numbers we can identify a trend, and I think it's a very positive thing that we're talking about so few numbers in Owasso. It means that the community as a whole is doing great work to stop the chain of transmission. The fact that we're not seeing an uptick in cases is a very positive thing. So it tells me that it's working. And so as we talk about the next phase, I mean, we know that shelter in place, I think, has done a great job to break transmission in Owasso. So how can we continue as we talk about gradually opening up? How can we continue to ensure that we're breaking that chain of transmission? And that's really, I think, the conversation that's important now, because people can still, I think, start to resume somewhat of a normal life as long as they're still putting precautions in place around sanitation and hygiene and masks and PPE coverage, so that even when they're out, they're still limiting the ability for that virus to be transmitted.
Well, you roundabout answered my next question, which was going to be, we hear all the time that because we're spread out, we're a rural community, that it's just not here because of that. It's just because of our how we're structured, and we're not dense like in New York City. But on the flip side, we took pretty aggressive measures early on at your advice, which we appreciate. How much has that played a part in the low numbers that we're seeing? I know you can't answer that 100%, but to the best of your ability, how much has that affected these low numbers?
I think because we have found that this darn virus, really, as I said, really transmits very effectively, very efficiently. So, and the only tool we had was the social distancing to break the chain transmission. And I know that I feel very strongly that if you hadn't done that, we'd be talking about a lot more cases than we are. And so I think the results you're getting are the result of the action you've taken. And then, so when actions are taken, they're positive and they work, then I think it is a good time to start talking about, okay, what's the next phase? What do we do next? Because my fear is that if we move too rapidly into opening up, we're going to be back up and we'll see an increase in that chain. So the information that's been provided around how to continue to go forward, continue to open your community up without resuming that chain of transmission is going to be really critical. And the actions you take, the information, the guidance you give, because I suspect when we do open up, we'll see a surge in some places, probably a greater surge in our more densely populated places. But it's my hope that if we continue to pay close attention to hygiene and disinfection and wearing mask covers when we're out in public, we'll still be doing a good job of keeping that chain of transmission fairly low.
So the concern with opening back up safely, slowly, which I think we all understand we need to do, do you feel like there's enough capacity in testing at this point for us to detect if we start to have a spike in order to make an educated decision?
So I think there is. I mean, so because it's been kind of interesting. We started off not having enough test kits. Well, now we have plenty of test kits. what we don't have, or at least what we're having problems with supply, is the collection kits. So I think, and we're getting more creative in how we're creating those test kits and where we're getting those supplies. So I think at this juncture today, if we had to ramp up testing even more, we could. It's just, the question is how long can we do it? And it's my hope that the supply chain will continue, so that as we open up, we're able to both ramp up testing and then also ramp up contact tracing, because the contact tracing, that's going to be really important to ensure that we do stop that chain, because when people are exposed, they need to know about it. One of the things that we've done here for that is that when we started this response, we had 4 people doing contact tracing. Now we have 25, and we also have a surge plan, so that when we open up, we'll actually add to our capacity to do contact tracing, because we know that for at least a short while, we're going to have to do even more of it.
Yeah. Well, one last question I have, and this is pertaining to the capacity of our hospitals. Your original goal when we started Flatten the Curve was to minimize the stress on our hospital systems and make sure that we had enough beds, enough PPE. Do you feel like even in the worst case scenario that could evolve once we start to open back up, do you feel like we've achieved that goal, that we're not going to overwhelm the hospitals, or is there still a chance of that?
So I'll be honest. If the governor hadn't decided to let hospitals open back up to elective surgeries tomorrow, I'd feel pretty confident that we have stopped that. But I don't know. I guess my concern is that once they start ramping up elective surgery, that's going to take a lot. I mean, each patient has to be tested for COVID before they do it. That's more PPE that's going towards that, as opposed to protecting healthcare workers who are dealing with COVID. So I'm not really sure, to be perfectly honest, and I won't know that really for several weeks. Now, one thing we do know is that out of every 10 cases in Tulsa County, 3 of those have been hospitalized, which tells me that the hospitals are staying, they're not being overwhelmed. Now, if that was like 3, 6, 7, I'd be really concerned. But 3 out of 10, that's a pretty good rate.
Great. Thank you, Dr. Dart.
You bet.
Any other questions?
Yes, I do have a question. Dr. Dart, are we seeing any relapse at all in any of the cases?
So we've had 2 cases since this started that we're not sure if they're relapsed or reinfected, and that's still something, because the newness of the virus. We're still not sure yet. We're not sure that everybody seroconverts and then has some immunity to the virus. But we've had 2 cases that were positive early on in the response. We thought they recovered. They were symptom free, but now they've tested positive again and they're having symptoms again. But as I said, it's just too early in this disease pathology to know if this is a reinfection. I mean, did they not produce antibody, or is it they never totally recovered, now they just relapsed? And we'll know more about that over time. It's just too soon to say right now.
Okay. The guidelines that are going to be written for specific businesses, how soon can we look to seeing that?
We're working on those right now. We want to be able to have something early next week, because we know that people are extremely anxious. And then with the governor's announcement yesterday, that put a little more pressure on us to get something done. And I know the governor had lots of information, but we wanted to break it down by industry, by personal care industry, and by food and restaurant industry, so that we can talk about guidelines specific to the practice that people are engaged in.
Okay. Regarding mobility data, how long have we been following that?
For 3 weeks now.
Okay.
And so it's interesting because every weekend it's ticked up. So, but I think it's positive that even though it's ticked up, our cases still we haven't had a huge peak. We just had a kind of a plateau.
I mean, that's what I think I'm seeing as I get out.
Yeah.
But you never know. I'm not out all the time. So, okay, thank you so much.
You bet.
Anyone else? Dr. Dart, once again, we cannot thank you enough for everything you've done for us. You've guided us from day one, and I credit really all of the success we've had here to your council and your expertise. And, it's times like these where you probably don't have to get in the limelight a lot like this. And when you do, there's a lot of pressure on you. You've handled it well, and you've done well by us. So we really appreciate it.
Well, thank you. You guys have done all the hard stuff, and you've had to stand there and speak to all those members of your community who I know are knocking on your door and calling you, emailing you. So thank you for having the courage that you've all had to have to do this work, and I really appreciate you as well. And if you need anything going forward, you know how to get a hold of me.
Thanks, sir. I know
Thanks,
you've got
guys.
another meeting. We'll let you go.
Bye bye. Have a good one.
All right. Thank you. Okay, well, I think the next step, I would like to, just for the citizens that are listening and our council as well, even though the council's heard this ad nauseum, I'd like to just kind of go back through and cover where we've been and to give some context to the discussion we're getting ready to have. March 6th, we had Tulsa County's first positive case of COVID-19. If you remember, those 3 cases were all determined to be travel related by the Tulsa County Health Department. March 17th was the first documented case community spread that occurred. And on that day, this council passed resolution 2020-10 declaring a civil emergency in the city of Owasso. I do think it's important to note that at that time, Owasso had no positive cases when we determined that civil emergency. The very next day, Dr. Dart, who we just talked to, he put out a letter recommending closure of local bars, restaurants, movie theaters, gymnasiums, and other entertainment and food service venues. This council called an emergency meeting upon receiving that letter and passed resolution 2020-11, limiting and closing certain commercial businesses due to the COVID-19 pandemic until April 14th. March 24th, 4 days later, Governor Stitt ordered his safer at home order for vulnerable populations and closure of non-essential businesses. We definitely appreciate the governor taking the lead for the state at that time. It was a surprise to us to hear that order, but the leadership was appreciated, and it actually trumped the resolution that we had passed 4 days earlier, closing down all non-essential businesses at that point. March 27th, pretty far into this, was our first positive case in Owasso at one of the Owasso medical facilities. It still wasn't an Owasso resident, but that was our first positive case. I don't know that we have the exact date of the first Owasso resident, but it was somewhere around the 1st of April. On April 1st, City Council, based on that first positive case and some other variables, we held another emergency meeting. In that meeting, this council passed resolution 2020-12, ordering shelter in place and closure of playground equipment until April 14th. The next meeting on April 7th, a regularly scheduled meeting, Owasso City Council extended that shelter in place order till April 30th. Since April 7th, we have been in contact with mayors and city managers all over the Tulsa metro area. Tulsa has been in contact with a group of business leaders that they're trying to gather data from, as well as chamber executives to kind of figure out how to structure this reopening safely. And also, in addition, we'll work with the Tulsa Health Department on that and have been working with Dr. Dart closely. Our current numbers in Owasso, 17 total cases, 16 recovered, and no deaths. And there's currently 1 active case. So where do we stand right now? We are currently still under the governor's safer at home order until May 6th, and closure of non-essential businesses until April 30th. The governor, as we all know, made an announcement yesterday amending his closure on non-essential business to allow personal care businesses to resume operations by appointment only starting tomorrow. These businesses include hair and nail salons and barbershops, pet care and grooming, spas and tanning salons. And again, we didn't have any prior communication from the governor that this was going to happen, so this is why we're having this meeting today. We had to react quickly because we've got to have something to tell our citizens by tomorrow. So what does all this mean for our decision today? I took the opportunity to contact the city staff and have them kind of put together a couple different options for us tonight so we could vote, since we have to do this on such a short timeline. So as it stands right now, option number 1, if we do nothing today, then Governor Stitt's order on personal care businesses will expire tomorrow, and we'll fall back to operating under Owasso Resolution 2020-11. That is the second resolution we passed that allowed personal care business that we called spas in the resolution to stay open by appointment only and operate with less than 10 persons inside the facility at a time. At the time that we did that, it was early on in the process, and we were trying to allow those businesses to stay open and generate income, but still stay safe. And Dr. Dart had signed off on that at the time that we did it. Pet grooming was not included in our original order, so that would not, they would still be able to open with the governor exception tomorrow. Option number 2 is to end our order effective at midnight tonight and allow the governor's order to take over. In this event, personal care businesses would open tomorrow following the guidelines established by the state. Option number 3 is to continue to keep personal care businesses closed until April 30th while we continue with what was our original planned partnership with the Tulsa metro area and the health department and area chambers to determine a plan to safely reopen Owasso, which would have happened or finished out over the next week. I've been advised that taking a more restrictive approach than the state potentially creates liability from claims of equal protection and interference with contractual business relations, meaning that, you know, we have some potential risk there if we create more stringent rules on a business than the state does. I think if Julie Lombardi is available, if Julie, you'd be willing to comment on that so everybody can understand where we're coming from there.
Certainly, Mayor, I'd be happy to. Really, it's liability, the possibility of a lawsuit or liability at this juncture in this entire circumstantial event we find ourselves in. Early on, it was very easy to make an argument that pretty much any city that wanted to enact certain restrictions or prohibitions was doing so in the best interest of the citizens and was reasonable. At this point, though, based upon the action the governor has taken to allow certain businesses to reopen effective tomorrow morning and then additional businesses the following week on May the 1st, really Owasso, if challenged, would need to prove that there is documentation, that there's data out there showing that Owasso's situation in particular is so extreme or so serious or warrants a continuation or restrictions that are more stringent than those imposed by the state.
Okay, and based on the information we stated earlier with Dr. Dart, our 10 days of continuing decreased positives, that obviously is not going to be something that we could fall back on. Am I correct in that, Julie?
Yes, that would be correct. Based upon the data that we're hearing and that we seem to have, I think we would be on shaky legal ground to attempt to say that Owasso's situation in any way warrants additional or more stringent prohibitions.
Okay. So that then, you know, almost for me rules out number 3. Obviously, we're going to open this up and discuss it. So, you know, I think our discussion is going to center around more option 1 and option 2. Option 1, falling back to our original ordinance, may create some confusion because the salons will still be open, but have a different set of rules than the governor's rules. So that may, in effect, kind of answer that question. But I think at this point, we'll open it up to council deliberation. Keep in mind, if we opt for number 1, then no action will need to be taken. So we'll fall back to the original or resolution that we passed. We do have language prepared for option number 2 in the event that we want to take a vote during this meeting. Any variation that we come up with on these 3 options, if that so happens, we'd likely have to call another meeting. So we'll have to give the city staff time to prepare those documents for us to vote on. So this time we'll open it up for council comments.
If I could just clarify real quickly, Mayor, if the council chose to make a slight variation on your options, there's every chance that we could craft make a motion.
Actually, Mayor, yes, it would just be a motion that would be reflected in the minutes. There would be no need for a resolution as we've done on previous occasions.
Just be a matter of changing the wording of the motion.
Yes, with a minor change, I understand that. I guess I was more referring to if we came up with a complex or somebody wanted to go down a complex set options, I think it'd be difficult to put that together tonight. So, yeah, with that, we'll hear from the council.
I'll just say that as far as what I think the governor has laid out, obviously he has a group behind him that felt like that the new executive order that he's put out is, from a health standpoint, is will work. They feel like it's supported that it could work. Makes me feel like that. I think you said option 2. Is that the governor's option?
Yes.
Just going, okay. Then option 2 seems like the appropriate thing for me.
Okay.
On option 2, if we do that, and going back to what Ms. Lombardi stated, or Warren actually stated, I know that some of the, you guys have gotten the same emails, that some of the hair salons are worried that they can't get their PPE in place quick enough there to do it according to what, not just what the governor's laid out, but also the cosmetology board, what they're requiring them to have in place as far as sanitation and everything. Is that, I would also entertain, if we wanted to, place the order to where it takes place Monday, if that's one of those variations that we can do. And if not, I'm with Doug. I think we just do what the governor had stated as far as option 2, but also maybe entertain to where we actually it doesn't go in place till Monday, to allow some of these businesses, not just the hairdressers, but all of them, that are going to need to have their cleaning equipment and masks and everything in place as they allow their customers to come in.
I'll interject just, and I totally get what you're saying, Bill, and those folks that aren't prepared yet to open up. But I guess the obvious is that if they're not prepared to open up, then they shouldn't be opening up. Nevertheless, I see your point. It's
well, speaking of that point, the issue is it's not a directive to open up. It's
right.
The possibility,
an option.
If they're not prepared, then they'll wait as long as they need to be prepared.
Right. And I guess the only thing was, and again, obviously I don't use a hairdresser, but so it's not something that I've come across a lot. I did back in my high school days, but if I even asked the expert in the house, my wife, this question, and she said, yes, that is true. They had talked about, yes, but then if somebody goes to someone else, they lose that clientele because they weren't able to open, so they weren't on equal footing. So again, I'm just throwing that out there as far as, saying, all right, everybody, you can open tomorrow, and those that aren't ready. And I realize it's not a directive. If you don't, or even if you don't want to open up next week, you don't have to. Obviously, you can open up. It's their business. It's their prerogative to open after the directives that we give, or after the governor's orders, or however we decide to go. They can open it up whenever they want to. I'm just saying that as far as, because this, I think, like Chris said, this kind of took us all by surprise that the governor did this without talking to any of the local mayors, or any mayor, or anybody that's a mayor of any city in Oklahoma, and he just decided we're going to do this. And up to then, it's been they've been pretty open as far as being able to speak to everybody. So I'm just, again, it's not going to bother me. I'm not going to be going to those establishments anyway. I don't tan either, so that won't bother me either. So I'm just saying, I'm just throwing it out there as just something to think about.
Yeah.
I'm sorry.
Go ahead.
I just want to say I agree with Bill, and I see where he's coming from, and also I've had some concern raised with the ability to even get disinfectant and just be ready for that. I think it's important. I mean, I don't know if it's a recommendation, but the emphasis on opening gradually and still keeping in mind, if you're not comfortable with opening, don't open. If you're not comfortable as a citizen going and getting your hair done, because there's a lot of disagreement. I can argue for both sides. And with that in mind, I think it's important to note that this is not, as it's already been pointed out, we're not telling you to open, but nor are we telling you to go get your hair done or so forth. It's just we've got to start opening gradually.
Hey, Mayor, could I speak to that for just a moment?
Sure.
There are perhaps salons that prepared and already have that equipment. I think we are on very legally shaky ground if we attempt to level the playing field by holding off until we think they've had sufficient time. That's probably more a matter between the individual salon and their board, which will be regulating them, which will probably be doing inspections, and which certainly has the power to fine and censor them in a number of ways. But I think for us, our only real concern can be based on infection rates, protecting citizens, that sort of thing, not whether a salon may or may not, or to try to keep a more level playing field for all of them. Does that make sense?
Does to me.
Does,
Yeah.
yeah.
Absolutely. Yeah.
Yep, that makes perfect sense, and that's why where you're at, Julie. Thank you.
I will chime in. I actually heard from quite a few salons, and both employees and owners. And another interesting kind of thing that I heard a lot was employees that are fearful of getting sick going in, that don't really have control. Obviously, Julie just addressed that. That's going to be up to each individual business owner. And I'll just echo what a couple others have said. This is not a directive, and to take that one step further, we all have varied opinions about this thing. I mean, we're all citizens and dealing with this just like everybody else is. You know, there are folks that are going to have to take their own approach to this as we start to open back up. And you know, the folks that are really really concerned about opening up too quick, which frankly I'm one of them. I you know, am probably going to stay put quite a bit more. I'm going to keep my business, continuing to do the same stuff we're doing, probably for quite a while after this is loosened up. That's my personal opinion. I want to encourage that everybody's going to be able to continue to exercise their personal beliefs with this, and those that feel like they don't want to get out in this still don't have to. You know, you can still shelter in place. You don't have to go shop. You can go out for essentials only. And I'm speaking not just about when this opens up tomorrow, but whatever happens May 1st, whatever we ultimately open up then, it's going to become even more of a challenge. So everybody's going to have their own approach to this, and know that we're all supportive of that at this stage.
Well said.
One of the things that I noticed that wasn't included in phase 1, 2, or whatever's coming in 3, there was no mention on the retail stores that are not currently open, like you know, in other words, not Walmart, Lowe's, and the big box stores, but all of the many just regular retail stores. I've looked over this thing several times, and I don't see anything on, you know, if you've got a little Hallmark store, or if you've got a little antique shop, or if you've got whatever, if you're just selling clothes down at Urban Owasso, I've not seen anything that addresses the actual retail stores. Is that something that we'll address on the May 1st opening, or is because obviously this one is just for the personal grooming type establishments, but what about the retail stores?
I read through the report as well, and I kind of assumed that they're in that last phase. I thought that's where that was encompassed, that we're basically saying everything else can resume regular business activity. But I agree, I didn't see anything specifically that addressed those types of businesses.
Because obviously, you know, there's a lot of little stores that there may be 2 or 3 people in that entire store, and it's not going to be near as likely that there is going to be a spread there than there is going to be in the churches. I mean, should a church decide to open under these guidelines? So that's just the thing that's really little
question that I have for Julie. In areas where the governor's executive order is silent, do we have the latitude to be specific? I mean, if we interpret his executive order as not really addressing those businesses, can we make an ordinance that does address those businesses and gives them some standard for how they can open back up?
Not really. the governor's order will need to be interpreted by the Attorney General's office or by someone on his staff. It's not for the municipalities really to interpret it and try to fill in the gaps. I think the presumption would be, and I'm speaking for the Attorney General, so very presumptuously here. The presumption would be that the governor's order was intended to be all-encompassing. If it needs additional supplementation, then certainly Governor Stitt will do that as time goes by. But in no way, I think, can we interpret that the municipalities have an open door to fill in what we may perceive to be gaps.
To follow up on that, the majority of retail stores have remained open as essential businesses, and I think that the governor's phases would certainly anticipate all businesses. And I think Councilor Dunn could well be correct. Anything that doesn't fall under those essential business categories would open up on phase 3. But mostly, and I would have to have Ms. Ferry speak to this, but mostly there's not been a question in the last few weeks about whether you can be open or not, essential or non-essential. There have been questions, but they've been answered.
One thing I want to make clear here, mainly for the citizens that are listening, 'cause it sounds like we're heading in a direction. I don't want to assume, but it sounds like we're heading in a particular direction where we may adopt the governor's order yesterday. I want to make it clear that does not mean that come May 1st we're going to continue to adopt what the governor puts out. We still have ongoing discussions with area mayors and city managers, business leaders. We've got our own chamber chairman, Gary Aiken, and Chelsea Levo, our economic development coordinator, talking with businesses and getting their ideas on what this reopening looks like. So we still have a week to kind of gather that information. We get back together again next week and come up with what our reopening looks like, whether it's something unique to Owasso or if we follow along with what the governor is suggesting at this point. So if we don't have any other comments, does anybody want to make a motion?
Yes, my question would be if we were going to make a motion to try to or to convert over to Governor Stitt's executive orders plan, would that just be for that, or any guidance on that, Julie?
Yes, actually, I think there really isn't a need, quite frankly, legally, to adopt the governor's plan or to take further action beyond today, beyond as it may affect personal care spas. The governor's order will go into effect, and what the city may or may not do there, the city may express support for it, but in terms legally, there's really no reason to adopt it. If I could, let me just tell the council as a suggestion at this juncture what an optimal or ideal motion might sound like. You might want to move to amend Resolution 2020-11, paragraph 2D as it pertains to spas. Regarding spas only, the order shall terminate at midnight on Friday, April 24th, in keeping with Governor Stitt's order issued on April 22nd, 2020, and spas may open for business on Friday, April the 24th, without limitation of 10 or fewer persons inside the facility. Something like that would probably be the type of motion that it sounds like you're looking at.
I move what she said.
I'll second what she said. Because you couldn't remember that level?
No, I was trying to write it down. I failed in the first 3 words.
Counselor Dunn?
Hey.
Yes.
Counselor Bonebrake?
Yes.
Counselor Lewis?
Yes.
Counselor Bush?
Yes.
Mayor Kelly?
Yes. Okay. Thank you, everybody. With that, we are adjourned until next week.
Thank you, everyone.
Hey, real quick question. Are we still going to be doing our meeting on Tuesday then?
Yes.
Okay. Terrific.
Come Tuesday, we're going to have to compile the information we've gained over this week and decide what we're going to do come the 1st, because everything runs out on the 30th.
Gotcha.
Okay.
So we need to adjourn, our motion to adjourn, is that right?
Yeah, go ahead.
So moved.
Second.
All in favor, say aye.
Aye.
All
Yep.
opposed, say nay. Okay, we're adjourned.
Thank you.
Good evening, everyone. Thank you.